Hello, everybody. Thanks for joining in. Uh, Busy day related to the pandemic. Again, what we've learned in this process is that to change the trajectory of cases, it takes some time. Right now, what we're seeing is that certainly over the last probably 3 or 4 weeks, as a community, we've kind of let down our guard. We had a lot of success in the summer going into the fall. Uh, and now we've seen the virus become more community spread. Our case loads are higher and will continue to be high. Our data from our positivity rate is stable because of the testing we're doing. But let's get into the numbers and talk about what they say. Unfortunately, we lost another member of our community over the last 24 hours. She was 76 years old. She had underlying health conditions, but certainly I'm very, very sorry to her family. And certainly let's think about her and her family members. Uh, the virus, we've learned, it has a brutal impact on our communities, vulnerable. And that's why we have been doing all the proactive things that we're doing, and we need the community's help to continue to be successful. Looking at cases, we now have 4,985 cases since March 16th. We have 66 new cases today. We had over 6,000 tests yesterday. So when you look at the positivity rate, we're still at 1%. But 66 cases is a lot of cases overall. The community now, we have 1,470 people in a quarantine because of this. And quarantines can be very easy and be few people, or they can be lots of people based off of how active the person was when they were infected and the spread. We have 340 active cases in the county. Again, at one point during the summer, we got that number down to 117. So it just shows you in the course of 6 to 8 weeks, as we are having a seasonal shift with COVID. I don't think we're having a second wave of COVID, but a seasonal shift that we need to get on our game and get on our game quick. Looking at hospital, well, let's go through the 66 cases, all right? Out of the 66, we have 12 higher ed, and out of the 12 higher ed, 2 of those were from out of the area and recovering here. So really, we had 64 out of the 66 cases transmitted in Onondaga County. We had 12 related to K through 12, 9 students. Out of the 9 students, 4 of them were remote, so they were never in a building. So those are really your community spread cases right away. We had 3 staff members, so 24 out of the 66 related to the education. We always knew we would have more cases related to K through 12, just bringing back people in that setting. So that's not really alarming when we look at overall schools and we look at the way that the schools have been dealing with this. But what is more concerning that we need to do better on as a community is that we have essentially 42 cases outside of higher ed and outside of K through 12. And when you remember the anxiety of the community as we went through these steps, saying it was going to lead, these 2 subgroups would lead to spread, that just hasn't been the case really. It's been the fact that we've had sick people going to work, mini clusters then happen. These aren't the clusters the state talks about. Those are broad-based clusters. These are clusters where you have someone go to work sick, they get their colleagues around them sick, they then go out to eat, they then go home, and then they then have family members who have a higher probability then of becoming infected with the virus. So community spread, we had 38 cases. We know the source of 22 of them. 16 of them we do not know the source. Household contacts, a huge number. Again, the positive with the household contacts is these individuals are already in a quarantine. So from a contact tracing standpoint and the risk to the community at large of infection spreading, that's already been mitigated. So 17 household contacts. Travel, 5. The states of, I believe, Alaska and Montana are in there, as well as other parts of New York. We have 3 cases at a senior facility. one staff, and 2 residents. Again, uh, these cases are concerning when you look at the direct correlations of loss of life with our senior facilities. They're there and they exist. So certainly, we need to follow that closely, and we're doing things proactively with wastewater testing in our senior facilities to try to identify early indicators that we have cases. We can't do that wastewater testing if we already have cases there. We have 3 unknown cases that are still being contact traced. Hospitalizations, 3 new admissions, 1 discharge, total hospital number of 26, ICU 8. So as we have cases going up, we'll have more hospitalizations. That's been the case the whole time. Um, Positive, we've been busy with testing. So that means that there's an acknowledgement that the virus is here and that we're out getting tested. That's what we can do to really help turn this around, to get this thing closer to and below 1% again as we go into what will be more seasonal pressure in the wintertime. Again, our 7-day average, 1.2%, really good still, but when you're at 0.7, 0.6, 4 weeks later you're at 1.2, that shows you need to readjust what's going on. So again, we ask people, enjoy the outdoor weather. It's beautiful today, and I'm not sure what it's going to be like this weekend, but please enjoy it. But we need to be smart with gatherings. We need to be very, very smart and cognizant of our health, so that we do not make the mistakes that we've been seeing all over the county, where folks who are sick are going to work and then spreading the virus. Other than that, if there is, I'm expecting another high case day tomorrow. Hopefully, I think it's going to be lower than today, but certainly we probably won't do a Facebook Live for that tomorrow. But again, what we do today impacts 2 weeks and 3 weeks from now with cases. So if we can make smart modifications to the things that we know work today, we can get re-engaged. We're going to grind this thing out, but we really need to really assess where we are and try to modify our own behavior with our own family so that we don't find ourselves in a quarantine or find ourselves as one of these positive